Hi, everyone. Thank you for joining us today. We are so excited for our very first Daytime Advocacy Institute. Usually we have these in the evenings, but we're seeing a lot of great interest in this afternoon time for our East Coasters. And really excited about this institute. We are going to be talking about such an important topic, which is how public policy can strengthen supports for family caregivers in the neuromuscular disease community and beyond. So let's dive right in. We have got a packed agenda, and to start, we're just going to review some really quick housekeeping tips. I'll provide some background information on caregiving in the neuromuscular disease community, and then we'll move on to our focus today, which is a policy spotlight on two bipartisan bills to support family caregivers. We have the ABC Act. This will be familiar to several advocates who are on the call. Joining us to speak about the ABC Act will be Amanda Giuliano with the Office of Senator Ed Markey. He is the champion of this great bill and really just such a huge caregiving leader on Capitol Hill. So really excited to hear from Amanda. And then we'll also be talking about the Credit for Caring Act, which is a newer piece of legislation for MDA, but it's been around the block a couple times. Joining us will be Rhonda Richards with AARP, which is one of the leading organizations in the world when it comes to family caregiving. So really excited to have our expert speakers. We'll then chat through some tips for sharing you and your family's caregiving story before taking collective action altogether. We'll have some time at Q&A for the end, but I'll also pause after each speaker to take a few questions as they come up. So just some really quick housekeeping items. Please make sure you are muted if you are not speaking. Right now is an excellent time to make sure that your microphone is muted. Closed captioning can be accessed in the bottom right-hand corner, in the bottom left-hand corner. Feel free to use the Q&A box to drop your questions in the bottom right corner, or you can utilize the chat function. If those aren't accessible to you, you can also use the raise hand function, come off mute to share your question verbally. And again, I'll be opening up for questions as we move along. Next slide. So to introduce myself, I'm Shannon Wood. I'm Director of Disability Policy here at MDA, where I work to advocate for policies that improve independence for the neuromuscular disease community. Next slide. So I just want to set the stage for today's conversation, really with a look at MDA's approach to family caregiving policy. So we know that research breakthroughs are leading to longer lives for so many different neuromuscular conditions, but due to the progressive nature of those conditions, many will require support at some point in their journey. And we know that family caregivers are really the backbone of the neuromuscular care system. They fill gaps left by insurance and really just decades of underinvestment in the direct care, the paid care workforce. Family caregivers in the neuromuscular community provide essential, highly specialized care, from managing complex medical tasks, assisting with mobility, providing emotional support, financial help, and so much more. So bottom line, MDA recognizes that family caregivers improve quality of life and prevent unnecessary, high cost, and harmful institutionalization. So helping people stay in their communities where they prefer to be. Next slide, please. So while health researchers have found a lot of significant benefits to family caregiving, things like personal growth and increased sense of purpose, we all know that there can be really significant challenges when it comes to providing care, from including physical, emotional strain, financial costs, fragmented support systems, administrative barriers or hoops to jump through to get the care that you need or the services that your loved one needs. So here at MDA, we advocate to address those challenges through public policy change. And as you might imagine, there are many, many bills around family caregiving that are currently being considered by Congress, but today we're going to be focusing on just two. So one is that Alleviating Barriers for Caregivers Act. You might hear me refer to that as the ABC Act. This addresses those administrative hoops that family caregivers and individuals who are navigating needed benefits on their own have to jump through. And then we'll also be talking about the Credit for Caring Act, which surrounds offsetting some of the high costs associated with caregiving. So looking at that first bill, the ABC Act, I want to provide just a little bit of background before turning it to our expert speaker, Amanda. So for those who aren't familiar, I'm sure many of you are, here at MDA, we have a top-notch, a very smart resource center that works tirelessly so that families don't have to navigate the neuromuscular disease journey alone. Top issue that family caregivers and individuals share with the MDA Resource Center surrounds difficulty navigating coordinating multiple government agencies, both state and federal, to get their loved ones the benefits they need. This can include insurance through Medicaid, Medicare, the Children's Health Insurance Program, or CHIP, and then also Social Security benefits or disability benefits, including Supplemental Security Income, or SSI, or Social Security Disability Insurance, SSDI. And what they constantly share with the MDA Resource Center and even with us on the advocacy team is what we refer to, it's a little bit of a wonky phrase, but it's collectively considered administrative burdens. And these are probably going to resonate with a lot of people on the call right now, right? So frustrating, invasive, repetitive paperwork to confirm your medical condition, waiting for hours to speak to someone, callbacks taking weeks, and really complicated application processes on top of confusing websites. Thankfully, next slide, there is bipartisan interest in reducing these administrative barriers through legislation that is the Alleviating Barriers for Caregivers Act, also known as the ABC Act. This was introduced by Senators Markey and Capito in the Senate. You see them there on the left. And on the House side, it was introduced by Representatives Kamak and Magaziner. Again, bipartisan, bicameral. And this may be familiar. This was a big priority of MDA at our Hill Day back in November. And we had really incredible success with sharing stories from the neuromuscular disease community to increase congressional support for the bill. So to speak to the ABC Act, we have a very special guest speaker, Amanda Giuliano. Amanda Giuliano serves as policy advisor in the office of Senator Ed Markey of Massachusetts, where she leads his team working on health, education, labor, and pensions policy. She previously served in policy positions in the House of Representatives, as well as Director of Legislative Affairs for the Biden administration. She is a tremendous ally to our caregiving work, and I'm so grateful she could be here. So Amanda, take it away.
Thank you so much, Shannon, and thank you to everyone who is online today to hear about these pieces of legislation. I'm a policy advisor with Senator Ed Markey of Massachusetts. He's the top Democrat on the Health, Education, Labor, and Pensions Committee's subcommittee on primary health. And caregiving is an issue that is really close to home for him. The senator's father cared for his mother when she developed Alzheimer's. And so he really experienced firsthand the challenges of caregiving. He saw the struggles that his father faced and wished that his father had gotten more support as a caregiver. So this informed a lot of his legislative work. It led him to introduce his Caring for Caregivers legislative agenda, which includes bills to help caregivers with common challenges like financial planning and nutrition. And he also saw firsthand the need for more cures and treatments. So Senator Markey has been a longtime proponent of increasing funding for medical research, especially at institutions like the National Institutes of Health or the NIH. And he likes to say that Massachusetts isn't only the Bay State, it's the brain state. And it's the research that's done there and across the country that improves lives and helps give people hope. So as Shannon mentioned, the ABC Act was introduced last year by Senator Markey, and it is bipartisan. There's a Democrat and Republican leading it in both the House and the Senate. And the bill would reduce red tape for caregivers who struggle to navigate the complex, burdensome, stressful processes each and every day, while also managing day-to-day family and professional responsibilities. So specifically, the bill would require the Centers for Medicare and Medicaid Services, or CMS, the Social Security Administration, and the Children's Health Insurance Program, or CHIP, to review eligibility, processes, procedures, forms, and communications to reduce the administrative burden on family caregivers and make it easier for them to enroll in services that they need. And it would also require those agencies to report to Congress about any issues they're facing and next steps they're taking to support family caregivers. So as you know, more than half of family caregivers act as an advocate for their loved ones with care providers, community services, government agencies, but about 1 in 4 have said that they want help with forms, paperwork, and eligibility for services. And they have a lot of competing responsibilities while also experiencing serious emotional, physical, financial challenges. And I don't need to tell you that caregivers have a lot more important things to do than complete duplicative forms or spend time on hold. So the ABC Act would make sure that caregivers' perspectives are front and center. It requires agencies to get input from caregivers as they're looking at ways to improve the services that they offer. So the bill is currently before the Senate Finance Committee for consideration. It has in the Senate support from 10 Democrats and 10 Republican co-sponsors. So we're incredibly grateful to the work of MDA and other supportive organizations for helping us build that list of co-sponsors. Adding to those co-sponsors certainly helps increase the likelihood that the bill will advance. And turning to stories, stories are an incredibly powerful way to share your personal experiences with policymakers. So it's much easier to understand what people's lives are like and the struggles they're experiencing by hearing their stories rather than just reading statistics. They help people empathize and relate to situations that they might not be familiar with. So this is really a priority of Senator Markey. He works to uplift people's stories when he's discussing policy, to remind his colleagues and the public just who is impacted by the legislation that Congress is debating. And what I mentioned earlier about watching his father act as a caretaker for his mother, he references that frequently anytime he's talking about Alzheimer's and the challenges both the people with Alzheimer's experience and the people who care for them. In November last year, the Health, Education, Labor, and Pensions Committee that Senator Markey serves on held a hearing about higher education. And the Markey office solicited stories from people about how people in higher education, like students, professors, and researchers, have been harmed by different policies coming out of the Trump administration. And one of the stories we received that Senator Markey actually highlighted in that hearing was from Justin, who's a PhD student at Boston University. He has congenital muscular dystrophy and he's an advocate with MDA. And he wrote about his work researching his own disease and how that research was made more difficult due to uncertainty with the availability of research grants right now. So our office had actually originally connected with Justin at an MDA Advocacy Day. And after that connection and that opportunity that he had to share his story with us in the office, we were able to reach out to him and solicit a letter for him for the senator to submit as part of the congressional record and to be able to share his story with members of the committee and the public at large. So being able to share his story on a broad stage like that really helped convey the real life implications of decisions that this administration is making and how policy decisions impact people with the conditions or people who care for those folks right now. So that's why sharing your story is just so impactful. I would definitely recommend that you do when you're meeting with legislators, with policymakers, that you talk about how you are personally impacted by research, by paperwork, challenges with agencies. Let them understand the challenges that you're going through. It's their role as legislators to improve policies that serve you. So please continue to share those stories, to reach out to your members of Congress. We are always grateful when we can have a better understanding of what our constituents are experiencing. So thank you all for joining. Thank you for everyone who is engaged in advocacy. It's such an important thing to do, particularly at this time. And certainly for anyone in Massachusetts, we hope to hear from you.
Thank you so much, Amanda. Thank you for sharing on the policy specifics of the ABC Act, but also on the importance of sharing those stories. And please thank your boss for his leadership in amplifying voices from the neuromuscular disease community. We were really excited to see Justin's stories shared on that level. So we do have a packed agenda, but while we have Amanda, I would like to just see if anyone has any questions specifically for Amanda. And let me turn it to my colleagues to see if we've gotten anything through the chat.
Shannon, this is Paul. We have a question from Nancy asking, is there a timeline for the bill?
Yeah, that's a great question. So, every 2 years, members of Congress have to reintroduce legislation. You basically have a 2-year time period when you're trying to get a bill passed into law. If it doesn't happen in that 2-year period, you have to try again and reintroduce the legislation. So the 2-year period for the current cycle that we're in ends on December 31st. So this doesn't mean that the bill can't become law, but we will have to reintroduce it again next year and again work on adding members as co-sponsors to the bill if we're not able to do it this year. So the more co-sponsors and support that we're able to generate from different members, the better chance that it has of advancing in Congress. And that's why your advocacy is so important to help us build a broad contingent of support from people on both sides of the aisle to advocate for passage.
Thanks, Amanda. That is a great question. Paul, any other ones in the chat you're seeing?
Having some great stories shared, as well as folks saying they've already shared their story, which is wonderful. Thank you, Nicole. Thank you, Andrea. Just one final question maybe on the process. Knowing that this legislation has to go through key committees, what has the committee reaction been to the legislation so far?
Yeah, so I would say that the most important thing is building momentum behind a bill. There are thousands of pieces of legislation that are introduced every single year in Congress. So there is no way for the committee to consider every single one. And one of the really important pieces in helping a committee prioritize a particular piece of legislation is when there is a lot of support for the bill. And that is conveyed both through members of Congress who sign to co-sponsor a bill, lending their name to it, saying that they would like it to be passed into law, and also the support of organizations who support it, organizations like MDA, like AARP, who say this is an important piece of legislation that would improve the lives of our members. We would really like to see that move. And so conveying that information to the committee is really helpful in trying to get this bill prioritized when they're looking at legislation to consider and to move forward in the Congress.
Thanks, Amanda. And we are happy to help build that momentum and be part of building that groundswell. So that's really helpful. I think we have time for maybe one last question of Amanda, if we have any that have come through.
Doesn't appear as if there are any other questions that, Amanda, you haven't already answered. There was one just asking what someone can do to be most helpful in getting the bill passed. Sounds as if sharing one story, getting their representative, getting their senators on board the legislation will be most helpful.
Yeah, that's exactly right. And as I mentioned, so there are 20 senators who are already co-sponsors of the bill. With Senator Markey, that's 21. So we still have quite a few to go to build support. So I would say if your senator or your House member for the House bill is not already on as a co-sponsor of the bill, reaching out to them, which you can do either by calling them or offices also have a form on their website where you can submit comments. You can reach out to them and request that they join as a co-sponsor.
Awesome. And we're going to be talking through some opportunities and how you can reach out to your member's office a little bit later on in the webinar. So Amanda, thank you so much for being here. Thanks for sharing your expertise with us and with our advocates. If you still have questions to ask, feel free to drop them in the chat, drop them in the Q&A. We will have time at the very end for additional questions, but wanted to make sure people had an opportunity to ask questions directly of Amanda. So Amanda, thank you so much. If you can move on to the next slide. Just very last on the ABC Act, what I wanted to show folks on the call is just that we are an absolute great company in supporting this bill. This just gives you a little peek at all of the different organizations across disability health spaces that are supportive of this bill. So we're in great company. Amanda, please thank your boss for us. We are such huge fans of Senator Markey and everything he's doing for family caregivers. So thank you very much.
Thank you. Thank you so much. And thank you for the opportunity to speak with you all.
Thank you. All right. Well, with that, we have one more policy. So we're going to be switching gears a little bit. And again, that's the Credit for Caring Act. So speaking to that bill, we have another awesome expert speaker, and that's Rhonda Richards. Rhonda Richards is a government affairs director at AARP, advocating for older adults and their families in Congress and the administration on issues including supporting family caregivers and helping people live independently in their homes and communities. So music to MDA's ears. She has successfully advocated for provisions in federal law and regulations, including the Raise Family Caregivers Act and support for family caregivers of people with Medicare. She received the AARP Lynn Bodiford Award for Excellence in Advocacy. Prior to her 20 years of experience at AARP, Rhonda served as staff in the U.S. Senate. So we've got a couple U.S. Senate ties on our call today. She is a graduate of Bryn Mawr College. Rhonda, thank you so much for being here, and I'll turn it to you.
Well, thank you very much, and appreciate the opportunity to join you and Amanda and others here today. If you can go to the next slide, that would be great. Well, again, thank you for the opportunity, Shannon and Jory and others, for the invitation to join MDA's Spotlight on Family Caregiving. I appreciate the opportunity. I'm pleased to join you today from AARP, which advocates for the 125 million Americans age 50 and older. I'm Government Affairs Director, and I handle AARP's federal advocacy to support family caregivers. And I want to say thank you again for your advocacy for the Alleviating Barriers for Caregivers Act and the Credit for Caring Act. AARP supports both of these bills that address different challenges that family caregivers face. And we thank Senator Markey and the sponsors of both of the bills for their leadership to support family caregivers. So as Shannon said, I'm going to talk about the Credit for Caring Act in particular. But first, I am going to talk a little bit about some of the data about family caregivers that help show the need to pass the Credit for Caring Act. And as Amanda and everybody have said, your personal stories and experiences are always critical for policymakers to hear and show the need to pass the legislation. When staff or a member of Congress comes out of a meeting, they're going to remember the stories and the experiences of their constituents that they hear directly. And that will be important to, again, letting them know how policy can impact their constituents and how their constituents need help. So I'm going to share with you some data about family caregivers and the financial challenges they face based on research that AARP has done. I'm mainly going to be using some data from a study called Caregiving in the U.S. 2025, which is a national survey and report on family caregivers that's conducted every 5 years by AARP and the National Alliance for Caregiving, and a 2021 study by AARP on caregiving out-of-pocket costs. Next slide. So under, I think there's, can you go back one? More, there we go, thank you. So when we talk about family caregivers under caregiving in the U.S., we mean 63 million adults who are providing ongoing care over the past year for a family member and friend. And that's 1 in 4 adults. Family caregiving impacts everyone. And there are family caregivers under 18 too, I will note, that help family and friends. But for purposes of the Credit for Caring Act and the data today, I'm going to focus on adults who are family caregivers. And many of you know this probably from your own experience. Caregivers are assisting with all different kinds of daily activities, everything from shopping and transportation, preparing and feeding meals, managing finances, bathing, dressing, helping someone out of a bed or a chair, things that help loved ones live independently in their homes and communities where they want to be. Caregivers are also helping with those medical nursing tasks and coordinating care appointments and across different care settings, monitoring health and advocating with care professionals, service providers, and government programs and agencies. And that's where the ABC Act comes in. Next slide. So family caregivers are providing care for about 5.5 years on average. And so if you're paying out of pocket for costs, that can really add up over time. And family caregivers face physical, emotional, and financial challenges. So for Credit for Caring, we're going to focus on the financial challenges. About 78% or 8 in 10 family caregivers incur out-of-pocket costs for caregiving and helping their loved ones. And they spend on average over $7,200 a year on out-of-pocket caregiving expenses, which also equates to about 26% of their income on average, which is significant. I'll also note that about 84% of voters support a family caregiver tax credit, which shows the resonance of this particular policy. Next slide. So looking at family caregivers who are working, there's about 70% of working age caregivers, people who are age 18 to 64, who are working in paid employment while they're also caregiving for a loved one. So they're balancing their caregiving and their work responsibilities and the impact of that caregiving on their work. And half of all family caregivers experience work impacts, whether it's going in late or leaving early or taking time off, reducing their hours, giving up work entirely, retiring early, and even more. And too often, leaving the workforce or reducing their hours due to caregiving results in a loss of income, retirement savings, benefits, and career mobility. And some of you on this webinar can probably relate to that. Next slide. About half of family caregivers experience at least one negative financial impact from caregiving. And that can mean everything from stopping or using up your savings, stopping saving or using up your savings, taking on more debt, leaving bills unpaid, or borrowing money from family and friends. It can even include struggling to afford basics like food. And some groups of caregivers are disproportionately experiencing negative financial impacts, including younger caregivers. Next slide. So here you can even see more of the kinds of impacts that I was just talking about in terms of negative financial impacts of caregiving, whether that comes in terms of saving or in terms of debt, even bankruptcy, and again, borrowing money or taking on more debt, bills or expenses, the work impact, which we talked a little bit about, and even impacting your home. So again, that's very, very significant. Next slide. You can also see in the next slide here that working family caregivers are more likely to experience negative financial impacts versus those who are non-working. And you'll see why I'm highlighting working family caregivers in a minute. Next slide. So just summing up so far, we've got the challenge: family caregivers need financial relief. They're spending on average over $7,200 a year, which equates to about 26% of their income. And they're experiencing almost half of them at least one negative financial impact. And without family caregiver support, many people would be forced into nursing homes with the government and taxpayers paying that bill. And we know people want to live in their own homes and communities, and that's generally more cost effective. And again, voters are supportive of a family caregiver tax credit. That's why Congress needs to enact the Credit for Caring Act. So now let's dive more deeply into this policy. So the Credit for Caring Act would help provide economic relief to family caregivers and help people keep more of their own money. This is a family caregiver tax credit, and it's focused on eligible working family caregivers. It's supported by over 100 organizations, from MDA and AARP to the Elizabeth Dole Foundation that focuses on military and veteran caregivers, to Paralyzed Veterans of America, to lots of patient advocacy groups, to employers, service providers, just a whole range of folks that have come together to say this is a good idea and Congress needs to pass this. Next slide. So this is, it's S925 in the Senate and HR 2036 in the House. The bill sponsors are Republican Mike Carey of Ohio in the House, and Linda Sanchez, who's a Democrat from California, Senator Shelley Moore Capito, who's a Republican of West Virginia in the Senate, and Senator Michael Bennet, who's a Democrat from Colorado. And this bill would provide an up to $5,000 non-refundable federal tax credit for eligible working family caregivers. And by non-refundable, it helps you if you pay taxes, but it won't make your taxes go below zero. And it would help offset a portion of different kinds of expenses, things like paying for a home care aide who might come in and help with things like eating and bathing and dressing, home modifications, things like ramps and grab bars that help someone live safely in their home longer, transportation costs, assistive technology, respite care to give the caregiver a temporary break, adult day services, and other expenses. The credit would help caregivers who are caring for loved ones of all ages. So whether you're caring for a child with a disability, for example, or an aging parent or grandparent, sibling, aunt, uncle, etc., it would help folks caring for an array of individuals. And the person you're caring for does not need to be a dependent, and you don't have to live with the person you're caring for. In both cases, you can live with the person you're caring for, but you don't have to be eligible. And the person you're caring for could be a dependent, but they don't have to be in order to be eligible. The person that you're caring for would need to have a certain level, a need for a certain level of assistance that's certified by a licensed healthcare practitioner, like a doctor or nurse. That's showing that they're meeting certain functional or cognitive limitations or other requirements for at least 180 consecutive days. So for example, they might need help with at least 2 daily activities like eating, bathing, and dressing, for example. Next slide. So in terms of how the Credit for Caring Act works, in terms of the tax credit, so family caregivers would pay the first $2,000 out of pocket in qualifying expenses under the bill. Then a 30% credit would kick in after that for qualified expenses after that first initial $2,000 in out-of-pocket qualified expenses, and up to a maximum credit amount of $5,000. So after that first $2,000 in qualified expenses, for each $1,000 you're paying out of pocket and qualified expenses, $300 of that would count toward the caregiver tax credit. The caregiver has to earn more than $7,500 a year in earned income. So that is the working part. When we talk about working family caregivers, they need to have at least more than $7,500 in earned income annually. And caregivers would also need to document their expenses. The tax credit phases out at higher incomes, starting at $150,000 of modified adjusted gross income for joint filers. And then it would fully phase out at around $200,000. And the income the credit would start phasing out for all other filers starting at $75,000 modified adjusted gross income, and it would fully phase out at about $150,000. And there are also provisions in the bill to help prevent what's called double dipping with other federal tax provisions. So there may be other tax provisions that you might be able to claim under a credit or deduction or something. So it would help make sure that you're not claiming the same funds twice, same expenses, for example. This bill is currently pending in the House Ways and Means Committee, which has jurisdiction over tax policy, and the Senate Finance Committee, which is the Senate equivalent that has jurisdiction over tax policy. And there are 80 bipartisan members of Congress in the House on the bill, including the sponsors and all the co-sponsors. It's very bipartisan. Co-sponsors are being added in bipartisan pairs in the House and Senate, so a Republican and a Democrat. And there are 8 senators on the bill. So that's where things stand with the bill in terms of sponsors and co-sponsors. So as you saw with the ABC Act, there's still definitely room for additional bipartisan co-sponsorship, and your outreach and sharing your stories and your experiences are important to building that support, again, which helps create that momentum and that support for Congress to focus on this policy and help bring financial relief to caregivers. So thank you very much for your advocacy and sharing your stories and your experiences with policymakers. And then the next slide is just my contact information. So thank you. And
that was incredible. Thank you so much for sharing all of that great information and also all of the background on just caregiving nationwide. And I will just make a personal plug. If you have not checked out the Caregiving in the U.S. report, it is so chock full of great information and great statistics. So encourage folks to take a look at that report and all of the great resources that AARP has on family caregiving. So with that, I again, we'll have time at the end for formal Q&A, but if anyone has any questions specifically on what Rhonda has shared or around the bill, we can open it up for a few questions. Paul, are you seeing any come through?
Yeah, thank you, Shannon. I am seeing a handful of questions. We got a question from Nicole, and this has to do with how this program or this potential program could potentially interact with others. There is Nicole mentions IHSS in California that pays caregivers to care for their disabled children. Also, caregivers of adults are eligible to be compensated in Michigan. Each of these has their own limitations, though, including some prohibitions on if parents of children can be reimbursed in some models. So just the question, I guess, is more so how would this interact with existing state-based programs that are also intending on trying to lower the financial burden of family caregivers?
Well, thank you for the question. So there are different ways to provide financial relief to family caregivers. One way is through self-direction programs in Medicaid, where family caregivers can be paid for providing care to loved ones. There's also ways under the VA, for example, for family caregivers who are caring for veterans to receive compensation as well. So this is another way in the form of a tax credit. So there could be somebody who is involved in one of the other programs. It really comes down to, does the caregiver in their particular situation, both the caregiver and the person that they're caring for, meet the eligibility criteria under the bill. A lot of the things that I talked about in terms of earned income, the income categories, the person that's being cared for meeting the level of care need, and for the duration of time, our expenses documented, various eligibility criteria. So it really would come down to, does a family caregiver and the person that they're caring for meet the eligibility criteria under credit for caring, in whatever form it may be passed by Congress.
Thank you, Rhonda. And actually, there's a similar question on that last point you made of if the caregiver in question is receiving disability benefits, are they also eligible to receive the tax credit?
Again, I think it depends on, is the caregiver, meeting the eligibility criteria in the Credit for Caring Act. Are they, able to provide care for a loved one and paying the expenses for care and meeting all of the criteria outlined in legislation, or again, in sort of whatever form it might be enacted by Congress. And here the focus is on helping family caregivers who are paying out-of-pocket expenses. So is the caregiver, having the out-of-pocket expenses that are qualified expenses under the legislation and meeting all of the other criteria. And again, it depends on whatever final version Congress may enact. What I talked about is the bill as introduced, and Congress can certainly make changes to legislation during the process as they consider it. So if Congress passes the Credit for Caring Act, it may have changes to what I just described to you.
Thank you very much. Maybe just one final question, and then we can address other questions. There's a lot of wonderful ones in the chat, so we'll get to as many as we can within our hour. But one final one, perhaps, before we get to our next section. There was a question about how the $5,000 figure was settled upon. Jennifer's already looking ahead, understanding that $5,000 may not be too much or as much as some may desire. Thinking about, is there a possibility if we get this passed, we could raise it in future years? Understand we got to get the original bill passed first, but maybe what is it about 5,000 is the number that was chosen?
Yeah, well, there was at one point in the past there was some support voiced for 5,000, and that's something that again, with the fact that family caregivers spend on average over $7,200 a year, hopefully this is something that could make a meaningful difference in for family caregivers. So that's important. And obviously 5,000 is what is introduced, and then Congress, it's up to Congress to enact that and the president to sign it into law, and then go from there. So look forward to working with you all to help get it across the finish line.
Thank you, Rhonda. Thanks for all of this great information and just for all of the work that AARP is doing on family caregiving right now. We are super excited to be partnering with you on these efforts. So again, if you have additional questions that you weren't able to ask, feel free to drop them in the chat. We'll have some time at the very end of the webinar to go through those. That being said, we do want to make sure that everyone has an opportunity to take collective action on these great bills that you've just heard about. So it's time to take that knowledge, turn it into collective action. We have a great opportunity for you to raise your voices, share those caregiving stories. You've heard about the impact that those have on the Hill. And so for that, I'll turn it to my colleague, Jory. Jory, you've got the mic.
Thank you very much, Shannon, and good afternoon or good morning, wherever everyone is joining us from. My name is Jory Haug. I'm the manager of advocacy engagement here at MDA. Great to see some familiar faces on the call, but so great to be here with you and talk about how we can all kind of join together, take what we've heard from our speakers this afternoon and turn it into action. As you can glean from the presentation, no one is better than you at telling your story. You are the expert in the room at telling your story, and you're the most effective messenger that we have in support of these two very vital bills that we've been working on. So what we'd like to do is invite you, if you have a story or you have some prior caregiving experience, anything having to do with what caregiving looks like in your world, we would like to hear from you. So just to give you a couple of questions to think about, and I know that we're going to drop our story share tool in the chat so that you have access to that link, but I want to give you a few questions to think about as you are considering how to craft your story to share. So what is your family caregiving story? Whether it's sometime in the past or whether it's something that you're currently experiencing, we do want to know what is that story that you have to share. So have you or your loved ones interacted with those state and federal agencies to obtain benefits? How would you describe those experiences? Were they positive? Were they negative? How did that impact you in accessing the care that you need? How has the high cost of caregiving, as many folks on the call have pointed out, impacted you or your family? So what are some of those out-of-pocket costs that you've been experiencing, and what impact has that had on yourself and your family? So as much as you're comfortable sharing, we want to hear it. We know that it's a deeply personal, caregiving is something deeply personal. And so we appreciate your candidness, and as much as that you're able to share with us in support of our advocacy, we're deeply grateful for that. So we do want to hear that. Your stories make the advocacy as powerful as as it can be. You've heard from our champions and our speakers throughout the call today that there really is no better way to make sure that we're hitting the right targets when we're sharing these stories. So to that end, there is also another way that you can share your story with us, directly with lawmakers, which we heard from Senator Markey's office is very important to their legislative work. So how can you take action and support our caregivers today? So we are ready to go. We have our Action Center ready to help you urge Congress to support the two bills we've been talking about for the last hour, the ABC Act and the Credit for Caring Act. So we have a customizable letter web form that you can make it your own. You can share your experiences and make sure that your personal information, as much as you're willing and comfortable to share, makes it to that lawmaker's desk. And so why do we ask you to share these stories? You've heard from the experts themselves, but we really know that these move the needle much more than a lobbyist kind of repeating the same things that lawmakers know. They really need to know what it looks like in your experience, whether it's opportunities in caregiving, barriers that you've experienced, anything that is in that that looks like caregiving in your world, we want to hear from you. And also make sure that you have a seat at the table when these decisions are being made. We want to make sure that we get your voices right where they need to be when the big decisions are getting made by members of Congress. So we also have a feature where if your members of Congress are very thankfully co-sponsoring the two bills that we have, they're going to get a thank you when you send that letter to your member of Congress. It's going to say thank you for your leadership, and we can thank them very profusely for their generous support in co-sponsoring these two bills. So we do have that link as well that we'll drop in the chat for everyone. And this is something that our advocacy team is working on every single day. So if you have questions about what to share, how to share, we are always an open book and willing to help you get the information to the right place. So we're so excited to continue the work with you and see where we can make good things happen and keep moving the ball forward. So with that being said, I'm going to turn it back over to Shannon for our final Q&A period.
Thank you, Jory, and really hope everyone is able to take that time with their action alert you'll see when you're in the system, our software makes it really easy. The policy information, the bill numbers, all of that is already included. But what's really important is just taking that extra minute or two to really think about what caregiving looks like for you in Richmond, Virginia, right? What kind of decisions are being made around your table when it comes to those out-of-pocket costs? What does it look like for your specific neuromuscular condition? So again, as you might imagine, Hill offices receive hundreds, thousands of emails a day. By taking that time to show, you're a real Virginian, you're a real constituent, and that beginning part of the action alert, it really helps make a difference and make it more likely that your story kind of resonates with the office. And, maybe like in Justin's scenario, your member of Congress can really amplify that story to drive change on a bigger level. So thank you, Jory. I hope we make it as easy as possible for everyone to take action today. And with that, let's open it up to Q&A. Paul, have we had any additional questions come through?
We have a handful of questions that came in during Rhonda's presentation, still primarily about the tax credit. There's a couple points being made about how home modifications, vehicle modifications, oftentimes are quite expensive, that those go beyond $5,000, of course. Another point being made about for someone with an income of maybe $40,000 or less, for that matter, that their income taxes are going to be quite low as it is. So just maybe we could speak a little bit about how this is kind of one piece in a larger puzzle of supporting family caregivers. Even if this bill is going to be helpful to some and maybe very helpful to some, that it's not going to solve everything, and that this is still going to be just one piece in a broader puzzle. So Shannon or Rhonda, maybe you could say a word or two on that.
I'm happy to start unless Shannon would like to.
All right, Rhonda.
Okay. No, I think that's very correct. This is one way to help support family caregivers and provide financial relief. It's not the only way. And I think there are multiple ways, multiple steps that Congress could take in this area. It's true that, yes, it's not going to cover all the costs that family caregivers face, and it's not intended to cover all the costs. It's to help offset a portion of some of the costs. Yes, it won't help everybody, but it will certainly help some people. We also support a bill called the Lowering Costs for Caregivers Act, for example, that helps folks who might have a flexible savings account, health reimbursement account, flexible spending account, health savings account, health reimbursement account, Archer medical savings account, would allow them to use funds in those accounts for qualified medical expenses of a parent or parent-in-law, for example. There are programs we're supportive of that I referenced earlier in terms of programs under, and that other participants referenced in terms of programs under Medicaid that enable you as a family caregiver to be paid for providing care for a loved one, or under the VA, for example. And some states have state-specific programs. Our state offices, a number of our state offices are also working on state level family caregiver tax credits or reimbursement programs or different things. So I think there's a variety of mechanisms that can provide financial relief. And so this is one that we're talking about today.
Just to add to what Rhonda shared there, we at MDA is also supportive of that lowering cost bill that Rhonda had mentioned, which we know again might not work as a solution for everyone in the neuromuscular disease community, but especially for the ALS community, those more adult onset neuromuscular conditions. It is another tool to kind of help address some of the financial challenges associated with providing care. So if you have additional questions about other bills that might be out there, please feel free to reach out to us. I have my email up on the screen now, and I'm happy to kind of walk through some of the other bills out there. Because like I shared at the beginning, there are so many different caregiving bills being considered by Congress right now, whether it's family caregiving or the home and community-based services, the kind of direct paid care workforce bills. So happy to chat about any of those. But the one thing I'll add to that piece is kind of political reality that we're operating in. The bills that are most likely to move forward in the legislative process are those bills that have buy-in from both sides of the aisle, that broad bipartisan support, and both of the bills that we talked about today fall within that camp. So just one piece of the pie, and maybe not a perfect piece of the pie, but it would do a lot of good for a lot of people. So great question there. Paul, do we have any additional questions?
We do, yeah. Nancy has a question. Nancy's always thinking very practically on what's happening on Capitol Hill. Nancy has a question about kind of the cost or the score of the bill. Is this very costly, or is it relatively affordable for our federal government, meaning that there's a chance it could get across the finish line?
So thank you for the question. So there isn't a score at the moment on the Credit for Caring Act as introduced this Congress, but there is there was a cost estimate of a modified version of the Credit for Caring Act a few years ago that was passed by the House Ways and Means Committee. That was $28.4 billion over 5 years. That was, again, a modified version of the bill that had a maximum credit amount of $2,000. The family caregiver did not have to be working, and there were other differences as well. So that's one cost estimate that's available, but it's true that cost is something that Congress considers when they are passing legislation. So that's something that they will, certainly look at and consider, just as they would with any other piece of legislation as it goes through the process.
To the point that Rhonda made earlier, I believe during her presentation, is that as the bill was presented today, as the bill was introduced, as it moves through the legislative process, we may see changes that could impact that score in either direction. But right now, we're working with the bill that we have, so we'll definitely keep the community abreast of any changes that are made to the bill. For example, what's included as sort of a qualified expense, but that is helpful.
I would also add that family caregivers are helping save, this was another point I made earlier, family caregivers are helping save taxpayer dollars by helping their loved ones live at home longer where they want to be, because they're helping to delay or prevent potential need for nursing home care, which is something that is, if people are, needing care long enough or need a certain higher level of care for a long enough period of time, they may end up in nursing homes, which are going to be more costly for taxpayers and the state and federal government. So.
And those estimates that bills get, they don't always kind of include that full picture of the potential savings a bill could provide. So it's important. And speaking with lawmakers, Nancy, I know that you've met with your lawmakers before. That's a very common question you're going to get about bills. Just feel free to kind of provide that extra nuance to help kind of contextualize those numbers. But great question.
Maybe just one more question to pose that I see within the chat. These are actually technically two different questions, but they both have to do with the $7,500 figure that was cited. Rebecca asks, was the $7,500 figure mentioned that the caregiver has to meet this income, or can it be family income if the patient is the spouse? And then later on, Ed also asked about this figure a little bit differently. He said he's just wondering how one can keep the average expenses down to $7,500 a year, perhaps acknowledging that it can oftentimes be higher than that. But maybe just a little bit more clarity around that $7,500 figure would be warranted.
Yeah. So the $7,500 is earned income. So that's income that the caregiver would need to have to be considered a working family caregiver and eligible for the tax credit. So that's not in relation to the expenses. That's in relation to the income that the caregiver would need to have. In terms of whether that could be attributable to the family or whatnot, I think that's more of an operational question once it's actually enacted. And again, Congress could, change the bill as introduced by the time it's enacted into law. So I think that's some of the details that would get worked out as things go through the process and it's actually implemented and whatnot. But that is a $7,500 income amount. That's not in relation to the expenses. For the expenses, the caregiver would need to pay at least $2,000 out of pocket in qualified expenses under the bill, and then the tax credit would kick in after that first $2,000, and it would be a 30% credit on qualified expenses, again above that first $2,000, up to a maximum credit amount of $5,000.
Thank you, Rhonda. At this point, I'm not seeing any additional questions. There's lots of great conversation and commentary from Nicole, from Jennifer, from Rebecca, from Nancy, from Ed, from Andrea. Thank you, everybody, for the excellent points, comments, questions you all are making in the chat.
Awesome. Well, thank you, Paul, for keeping an eye on the Q&A for us. Rhonda, thank you so much for being here, and just thanks again for all of your praise is doing around family caregiving. So thank you, everyone, for joining us. Please take some time today to complete that action alert. We'll make sure that you have all the information you need to do so. If you have any questions, please don't hesitate to reach out. And thank you for being an advocate.